Yeah, absolutely. Well, so I think in two ways. One, I think this is something certainly they could share with their patients. We have actually, as we've done some metrics on our website, we have lots and lots of healthcare professionals that are visiting our website looking for information to share with their patients. We among other things, have a pretty good emphasis on rare kidney disease here. And I think we have some of the most comprehensive information on the web, on the internet for some things. So, even if it's not something they're specifically learning from, certainly as a resource for their patients, there's something. So that is the first one. Secondly, intentionally, we have a day, the Thursday of Kidney Action Week, the 21st of March, a day specifically aimed at healthcare professionals. So it should be clear, these are not accredited courses, but these are, at a higher level and aimed, specifically for something for people to benefit from, if they're healthcare professionals. So in thinking about that, we have some topics that are, kind of a deep dive on areas that they may not know a lot about. We have a deep dive on IgA nephropathy as an example. And really kind of blending those two worlds. I actually worked at a mental health organization several years ago, and we did this session at a live event called Both Sides of the Couch, right? It was like the therapist and the patient and what they were thinking coming into the room and dealing with those kinds of things. And we're doing the same kind of thing here around IgA nephropathy. What's a physician thinking about when an IgA nephropathy patient comes in, or potential for one? What's the questions that the patients have that they want to have asked? So I think that's a really practical kind of a session that they can benefit from. We also have some sessions on the resources that we have available for professionals. We have a very popular website, both for patients and professionals, called Kidney Kitchen, but we have a Kidney Kitchen Pro website that allows dietitians to create meal plans for their patients. It connects to the USDA database, so we have 800 recipes that we have had dietitians review. Chefs actually make them to make sure they actually come out well with the ingredients and the recipes there. So, giving some sense on how to better utilize that is something. And of course, that's something that physicians and nephrologists would also be able to use as well. And then we have, some new and emerging topics too. APOL1 mediated kidney disease is one. So we have a session focusing on that that's aimed at healthcare professionals, talking about the research that we have in that area, where things may be headed to. Of course, we are looking to not only the patient community, but the healthcare professional community to help raise awareness about our AMKD Awareness Day, which is on April the 30th. So this is a good kickoff for that. It's the first of its kind. It's the inaugural event for that. So this is a lead-in, kind of talking about the prevalence and the ins and outs of AMKD Day in preparation for that. And then, it's, while not aimed at really healthcare professionals or patients in general, actually our Friday, our last day, is aimed completely on new innovations. And that's a broad terminology, but it's innovative trials that are coming into market, innovative devices that are coming to market, an update on the artificial kidney as an example. So we have 8 different topic areas and speakers talking about that, and that's really going to play for anyone. So I guess the takeaway is, what it means to healthcare professionals is resources for patients, finding out what resources AKF has for healthcare professionals directly, and also, giving them insight into the latest innovations and the latest trends in nephrology.